Hey y'all, it's Gabriella, and today I'm going to be talking to you guys about music therapy. Basically, music therapy is an effective form of treatment because it is used for your mental, emotional, and physical health. And in short, it means that music therapy works naturally across the board for a majority of your health triangle and things that you might be going on in life. The American Music Therapy Association basically says that music therapy is a health profession that uses music, skills, and factors in a therapeutic relationship to address your health triangle. There isn't much history on music therapy because it's still new and growing. However, there is some background. Basically, one of the biggest things is that it's a new process, but it's great for all ages. Like, I'm talking fresh out the womb to on your deathbed. Whole spectrum. That and for a vast majority of disorders, diseases, and disabilities. That can be speech and communication, anxiety, depression, PTSD, breathing problems from asthma, reducing pain, sleep patterns and weight gain, and your motor functions. If you want to become a music therapist, you have to have a bachelor's degree from one of the 72 approved schools from the American Music Therapy Association, including 1,200 hours of clinical training. Not only that, but to qualify after getting that bachelor's degree and the 1,200 hours of clinical training, is that you have knowledge in psychology, medicine, and music. You have a desire to help others, a love for people in music, and that you're a patient. Now, your actual music therapy sessions are not really predetermined. Like, I can't tell you for sure what would happen if you were to go to a music therapist. But you can expect anything along the lines of a certain music selection or a setting. It can be done in your sessions can happen in multiple settings. It can be used in a variety of ways, whether it's dance, composition, singing, or playing an instrument. Basically, music therapy is for the client. And that individual is going to have their own opinions, ideas, values, beliefs. They're going to have their own interests, and they're going to have their own issues that they're coming to music therapy for. So it very much depends on that person and what's going on. So really getting into the health aspect of it. Mentally and emotionally speaking, it's great because music therapy can help you rediscover yourself, and it motivates you intrinsically because it's more fun, and usually when things are more fun, you're more inclined to stick with it. It also doesn't feel like work. It doesn't feel like therapy. It feels good. So it's easier to keep up with. It'll help you maintain and regain some of that stability in your life that maybe you lost because of something that you're going through. Music is great, and one of the examples that I always like to use is that music has been a voice for me. So whenever I'm going through something and I cannot effectively communicate how I feel or what I'm going through, there is a song out there with lyrics and a story that says exactly what I've been trying to say but couldn't figure out. And that's so comforting because it makes you feel less alone. And there's a lot of studies that prove that idea that music makes you feel that way, and it makes you feel good because you're not alone. It becomes an expression that people can use. It also strengthens your cognitive skills. So if you are musically involved at a very, very young age, you are more likely to have stronger neural connections in your brain and thrive in a learning environment. Similarly speaking, when it comes to your physical health, when there is damage to your Broca's area of your brain, it means that it's hard for you to communicate because it's hard for you to move your mouth, your tongue, and make speech that makes sense. So aphasia patients, people who have damage there, struggle, but music therapy helps them strengthen those neural connections in those areas, and that physical training will get them right back to where they were, or at least close to it. Music also can bring down your heart rate levels and raise or lower your blood pressure levels, which is great when you're having anxiety or depression. It kind of calms you down. and affects your state of being. So there is that. If you get a chance to check out the website that I have an interview of Kylie and a video of babies who have moms who are addicted. That kind of, for lack of a better word, transferred that to them, and how music therapy helped them with this opioid addiction. The other side of the argument is that it brings up negative emotions and memories, but that's not really the case. Most studies will show that it brings up positive ones, and it's really just a perspective that you have on it. But music therapy, what it does is it not only trains you to communicate that better, but to look at it in a different way, but through music. Also, people will say that because it affects your heart rate levels and all of that, that you can have like a heart attack or things like that, or, but those are the extremes, and music isn't the cause of these extremes. Most cases when that happens, it's because of external factors, and it's not likely that the music is what's doing it. It could be a factor, but it's not the factor that puts you on the level. Like, you're not going to get hypothermia from listening to music because of your body temperature changing. I would hope that in reading and carrying this presentation that maybe you're more consciously aware of music and how it affects you. So I would hope that, you guys share music, make music, and feel music. When you're listening to a song that tells a story or that makes you feel good or makes you think of a person, send it, share it, put it out there, make music. If you're into that or you're good at that, write, express yourself with music, whether it's lyrical or just musical, or both. Make something, feel music. So like sing, dance, blast a song with the radio on, sing it at the top of your lungs with your friends, sing in the shower, just connect with the vibes that music provides. But thank you guys for listening. I hope you guys enjoyed the presentation, and thanks again. Bye.